revision on the effects of drugs. So, what are drugs? Generally, drugs are any substance that taken and affect the body function. All drugs work by increasing the release of neurotransmitters. False, of course, because this is only one way of the action of the drug on the body. Other drugs can inhibit the release of neurotransmitters, or it can interfere with the neurotransmitters binding sites. Also, some drugs can delay the breakdown of neurotransmitters to give a prolonged effect. A drug that helps prevent, cure, or relieve a medical problem, of course, this is medicine. Angina is a common pain sensation. No, this is not right. Angina is a cardiovascular disease. Common pain sensations like headache, stomach ache, and muscle ache. Pain receptors send impulses to brain. Pain relievers that do not cause a loss of consciousness are called analgesics. Analgesics that work on the central nervous system are called narcotics. They are used for severe pain and pain in case of surgical operations because they are very potent. In case of using someone else's prescribed drug or the excessive use of a legal drug, this is a drug abuse. You are using it. High blood pressure it's a circulatory system disease because it's related to the blood vessels, or you can call it a cardiovascular disease. Stimulants and depressants are used to deal with the diseases related to the nervous system, of course. How do stimulants work? Stimulants work by increasing the activity of both the central nervous system and the sympathetic nervous system. By slowing down the activities of the central nervous system, depressants can relieve anxiety and sleeping disorders, A and B. When a medicine is taken for an unintended use, this is known as, in this case, this is a drug misuse because it's not intentionally to use it the wrong way. Inappropriate use of a drug for non-medical purpose, this is drug abuse. When a person doesn't follow the prescribed dosage of the medication, this is a drug misuse. When a person's body develops a chemical need for the drug in order to function normally or to give a good effect, this is a drug addiction. So we have cocaine, which is a central nervous system stimulant. So this is one of the effects of cocaine. At first, cocaine increases the heart rate, then it starts to slow down. No, cocaine slow down the heart rate first, then the heart rate increase very fast, very rapid. Cocaine stimulates the release of dopamine and serotonin, both dopamine and serotonin. Tolerance occurs when a person needs larger or more frequent dose of the drug to achieve the same effect. That's true. Psychological dependence on a drug happens when a person believes he or she needs a drug to feel good. True, of course. It's different from physiological from physiological dependence, because physiological dependence means that you need a certain drug by certain doses to relieve a certain symptom or to feel good. Cocaine stimulates the sympathetic nervous system. Its abuse will lead to low immunity, high blood pressure, and convulsions. What is the effect of cocaine on unborn babies? It will lead to smaller circumference of the head. It will cause kidney failure and addiction to the baby. It will lead to early separation of the placenta from the pregnant mother, of course. Caffeine can cause dehydration, yes, because it increases the rate of urination. Tolerance occurs when we said that when a person needs a larger amount of the drug or more frequent doses to achieve the same effect. When a person stops taking a drug after prolonged use, he might experience symptoms of withdrawal.